We all hear all those around us stipulating that they're in some type of diet. One is vegan, one is paleo, one is keto, and you're just in the middle trying to figure out what they all are and how are they even beneficial. Today we're going to discuss on the main type of diets and what each of them consists of. So let's dive right in. There are several types of diets out there available, but we're going to talk about the main ones, which would be plant-based or vegan, keto, the paleo diet, low carbohydrate diet, very low carbohydrate diet, the Mediterranean diet, Whole30, and intermittent fasting. So the plant-based diet or the vegan diet basically consists of the intake of plant-based foods. There is no dairy, meat, or animal products consumed, and the protein intake mainly comes from legumes and soy products. So the goal of this diet specifically is for those who are environmentally friendly. When you go on a plant-based diet, there's less carbon products produced. Also, it's ethical because we know that some animals are mistreated while they're getting prepared for consumption, basically. But also it's done for health maintenance and disease prevention. There's a lot of research out there showing that a plant-based diet has many health benefits, including management and prevention of diabetes, high blood pressure, and high cholesterol, among other things. So the next type is the well-known keto diet. It is a low carbohydrate, high fat, and high protein diet. The goal of this diet is to consume about 50 grams of net carbohydrates daily, and some even suggest below 20 grams. So this is a very carbohydrate restrictive diet. Because of that reason, it can be very effective at helping with weight loss. It also does consist of low sugar intake, and rather than consuming sugar, it should be replaced for alternatives with things like stevia, monk fruit, and erythritol. And then the goal for this is to promote ketosis, which is basically the burning of fat. So by burning fat, again, it's eliminated through the body, and that there are research articles out there that do speak of the benefits of the keto diet, such as managing, again, diabetes, high blood pressure, high cholesterol, as well as inflammation. So the goal for this diet, again, would be to promote fat burning or ketosis, as well as health prevention and maintenance. There is a little bit of conflicting information out there, as some research articles say that the keto diet is beneficial, and other research articles say that it's not, because it does consist of a high fat intake, and in those with heart disease or uncontrolled high cholesterol, that can be detrimental. So it's best, if you like to undergo this diet, to consult with your healthcare provider to see if it actually would be beneficial for you. Next is the paleo diet, which attempts to follow its name by mimicking the food intake of those who lived during the Paleolithic era. And these were actually the cavemen. And they believed, or whoever came up with this type of diet believed, that cavemen only ate nuts, grass-fed animal meat, fish, and oils from fruits and nuts, and they maintained healthy while avoiding grains, legumes, dairy, salt, starches, and processed foods. Now, there's a little bit of a debate in this type of diet, because there is a group that says, yes, they did not eat grain, legumes, dairy, salt, starches, and everything else that I mentioned. But there is actually another group that says that it's quite the opposite, and that they did have access to legumes and grains specifically. There's also a debate because this type of diet limits the intake of legumes and grains, which we know is a high source of fiber. So that's a bit of a discussion that's being had right now. But the overall goal of this diet is to basically consume unprocessed foods and things that could hurt the gut biome, like dairy and salt and processed foods. Next is the Mediterranean diet, and many people know this diet because this one typically seems to be the one to be the first resort for people who are trying to lose weight or just do kind of like a lifestyle change. And this diet consists of the intake of fish, monounsaturated fats from olive oil, as well as fruits, vegetables, whole grains, legumes, nuts, and then moderate alcohol consumption, but particularly red wine. There's a lot of research in regards to this type of diet, as it can help prevent and manage things like high blood pressure, high cholesterol, diabetes, chronic fatigue syndrome, and then also decrease inflammatory markers and improve cardiovascular health in those who are either at high risk or already have lab results showing high inflammatory markers, as well as history of heart disease and things like that. So there is a lot of research in this diet, and like I said, many people resort to this one first. This one typically is the main one that people resort to because it's more flexible in regards to the type of foods that are eaten, versus the other foods are a little bit more restrictive. So next is the Whole30 diet. So this one is more of a diet as specified rather than a lifestyle change. The other ones that I've spoken about mainly are more lifestyle changes than diet specifically. So this one consists of a 30-day diet plan, consuming only whole unprocessed foods like lean meat, seafood, eggs, vegetables, natural fats, and nuts, while avoiding legumes, dairy, alcohol, sugar, and then additives such as MSG and carrageenan, as well as sulfites. So the goal of this diet is kind of to perform a quick start on your body, is like a detox process or a boost, to then transitioning to a lifestyle change in diet. So it's basically you do 30 days of this type of diet, avoiding anything that's unprocessed, and then things like legumes, dairy, alcohol, and all the other stuff that I mentioned, to then do like a detox process on your body. A lot of people tend to lose weight quickly during this diet, but the problem is that it is a bit restrictive, so it can be a little bit difficult to adhere to for 30 days. So next is the low carbohydrate diet. This one, again, very common. Many people say I'm on a low carb diet. And this basically consists of how the name states, low carbohydrate intake. Typically, it's about less than 130 grams of carbohydrate intake daily. The research says that there's many benefits to it. Primarily, this type of diet is great for weight loss when you eliminate carbohydrates, as carbohydrate intake is very high in this country. Everything we eat has carbohydrates in it, specifically simple carbohydrates, and those things come more from like your breads, your pastas, your rice, baked goods, and a lot of things that many of us like to eat. So by limiting these things, it does help with weight loss. And it's really good for anyone looking to, again, lose weight. It's a bit more flexible because what you're really doing is just counting your carbohydrate intake. So again, typically when you limit that, and if you consume about 130 grams or less, there's a lot of research stipulating that there can be significant amount of weight loss from 5% all the way up to 10% or even more, if adhered to the right way. Meaning if you also incorporate this with avoiding unprocessed foods, high fat intake, and sugar intake. And then we also have the very low carbohydrate intake, which is the same thing, low carb diet, with the exception that this one does have a restriction of about 50 to 20 grams of carbohydrates daily. This one's a bit more difficult to adhere to because that's a very low carb intake, and like I said before, a lot of the things that we eat have carbs in it. But there is a lot of research that if you want to lose weight quickly and effectively, the very low carb diet is the way to go. It does help with diabetes, hyperlipidemia, high blood pressure, and many other health conditions. But again, it's very difficult to adhere to because of the very low carb intake. So sometimes also people cannot tolerate it, as it does cause a fatigue effect. People get headaches as well. It's kind of like undergoing a carb detox. So that sometimes puts people off and prevents them from adhering to that type of diet. But this diet specifically is not really designed to be sustained for a very long time. This is more so for kind of like the boost process of the dietary or weight loss journey. To learn about intermittent fasting, stay tuned for part 2 of the video.